Hello, I'm Roger. Today we'll be discussing bioidentical hormones and their use in replacement therapies for people with hormone deficiencies. We'll explore the science behind bioidentical hormone replacement therapy, how bioidentical hormones act in the body to restore health, and the common types of therapy in cases of hormone deficiencies. So first, let's talk about what bioidentical hormones are. The human body naturally produces dozens of hormones. Hormones are best understood as signaling molecules that relay important messages across various systems. Well-known examples of hormones include insulin. Maintaining the right insulin levels is crucial for good metabolism. Insulin dysfunction is associated with metabolic diseases like diabetes. The sex hormones. Testosterone is the dominant hormone in men. For women, they are estrogen and progesterone. The sex hormones are responsible for reproductive function, sex drive, muscle building, metabolism, and mood regulation. Human growth hormone. Human growth hormone, or HGH, is a principal member of the anabolic family of hormones that build and repair tissue throughout the body. Now, these are just a few examples of the many hormones that we need in order to remain healthy. Unfortunately, as we age, many of us begin to lose hormones. We may spend years with below normal hormone levels and not know it until a screening is conducted. When levels of crucial hormones plummet, this can trigger a host of unpleasant and often dangerous health events. Hormone deficiencies are sadly often the last thing that a physician will look for when a patient presents with the known signs and symptoms of specific hormone disorders. Medical pioneers in the hormone replacement field are working to change that. For example, the science tells us that men with a testosterone deficient often experience higher rates of depression. However, many psychiatrists or family practitioners prescribe men pharmaceutical drugs like SSRIs before investigating the possibility of a testosterone deficiency that is frequently the source of their depression. In the many cases where the underlying cause of poor health is a hormone deficiency, we have helped our patients recover their well-being through bioidentical hormone replacement therapy. So what are bioidentical hormones and how does bioidentical hormone replacement therapy work? Before moving on to therapy, let's discuss what bioidentical hormones are. As we mentioned earlier, our bodies normally produce adequate amounts of our hormones to maintain good health. These naturally occurring hormones are called endogenous hormones, meaning that they are sourced genus from inside endo. When natural levels fall under a threshold into dangerous territory, modern science has afforded us the ability to replace endogenous hormones with exogenous hormones. Exogenous hormones are synthetic versions of endogenous hormones that are sourced from outside the body. Several U.S. pharmaceutical companies produce synthetic hormones in laboratories. These exogenous hormones are called bioidentical hormones because they are exactly the match of the molecular structure of endogenous, naturally occurring hormones. Because the molecular structure of natural and bioidentical hormones is precisely the same, hormone replacement therapy is largely safe for the vast majority of patients. There are a number of bioidentical hormone replacement therapies for various hormone deficiencies. So let's explore these now. What are the different types of bioidentical hormone replacement therapy? Here are two of the most common types of bioidentical hormone replacement therapy. growth hormone replacement therapy. Human growth hormone, or HGH, as we discussed earlier, which is closely involved in a number of anabolic activities in the body, is responsible for tissue growth and repair, among other activities. In the case of human growth hormone, it helps to maintain proper metabolism, fat burning, muscle development, and may play an important role in the vascular system, including the heart. Because growth hormone replacement therapy was pioneered earlier than most other types of bioidentical hormone replacement therapies to help children with low levels grow normally, it is one of the best studied types of hormone replacement therapies in terms of proven safety and effectiveness. Testosterone replacement therapy, or TRT. Testosterone replacement therapy has come a very long way in the last few years. Testosterone is the primary male sex hormone. Most of it is produced in the testes, but some is also produced in the adrenal glands positioned above the kidneys. Studies estimate that men lose about 1% of their naturally occurring testosterone every year after their levels peak at the end of adolescence. Symptoms of low testosterone include low energy, lack of sexual libido, muscle loss, fat gain, and even mental health disorders, as we discussed earlier. Fortunately, testosterone replacement therapy is increasingly affordable to men around the U.S. of average incomes. Human growth hormone replacement therapy and testosterone replacement therapy are just two of the many therapies available to patients with hormone deficiencies. Is bioidentical hormone replacement therapy safe? In most cases, yes. Bioidentical hormone replacement therapy is safe. There are, however, some conditions that disqualify a candidate from receiving therapy. For example, some patients with cancer should avoid growth hormone replacement therapy due to complications that might interfere with treatment. Reasons that a doctor might recommend against bioidentical hormone replacement therapy in individual cases are called contraindications. Our trained doctors are skilled at screening patients for all the known contraindications associated with bioidentical hormone replacement therapy, including conducting a full blood panel and other tests prior to beginning the therapy. Does bioidentical hormone replacement therapy cause side effects? Side effects of bioidentical hormone replacement therapy are very uncommon, but they do occur. They are most often mild and easily resolved through titrated dosages of the hormones or other means. Rarely they are more serious. Our doctors monitor patients throughout the therapy, so if side effects do occur, patients and doctors can work together to take swift action and correct course. For many hormonally deficient patients who have not found relief from their symptoms with conventional treatments, bioidentical hormone replacement therapy can be hugely beneficial. Many of our patients have fully recovered their health after visiting our clinic for therapy. If you have a diagnosable hormone deficiency that threatens your well-being, then you are a prime candidate to receive rejuvenating therapy using bioidentical hormones.